Hi, thank you very much. I'll just like to welcome everybody to the first Children's ONS via Skype. It's been a little while since our last meeting. It does seem quite a while, but we've only actually missed one meeting, which I think is very good news. Just a bit about the format. We've got a couple of new members. Rachel Marchmont, I'd like to welcome you. And we've got Nathan Collins and Adaya Brandon from the Youth Parliament, so welcome. Firstly, a bit of housekeeping. I've got a few notes here about Skype meetings. Please note that this meeting of the Children's Services Overview and Scrutiny Committee is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. In order to ensure the meeting is managed effectively, please could everybody present follow these ground rules for speaking. Only speak when invited to by the chairman. State your name before you speak if you've not been introduced. Some people may be dialing on a phone, so they don't have the advantage of seeing your faces and names in front of them. Mute your microphone if you're not talking. If you would like to speak, could you type a RTS, request to speak, in the instant messenger conversation panel on the left-hand side of the screen and click the arrow button to send. Please note that panels are visible to everybody, so only type things that you want everybody to see. If you're able to, it'd be helpful if you could indicate the particular issues you wish to speak on. That will help us maintain the flow of the meeting, particularly important if you want to speak after somebody's started a conversation. If there are any recommendations moved to require a formal vote, these will be carried out by the chairman and will ask for and against or abstain for each council member of the committee. Finally, can I please ensure that background noise is kept to a minimum? As far as possible, could you turn off your mobile phones and other devices or switch them to silent or mute setting for the duration? Thank you. First off, I don't believe there are any apologies. I'll just check there's none arrived last minute.
There's been no apologies, Councillor.
Thank you very much. So in that case, we have no substitute members. Declarations of interest. Does any councillors have any disclosable pecuniary interests or other local interests on the agenda? Okay. Sorry, I'll just unmute. Rachel.
Thank you, Chair. I just feel like I need to disclose for item 6 that I'm an employee of the National Probation Service, which is a partner agency of the YOS. I don't believe it should make a difference. I'm not entirely sure if I need to declare it, but I think just for transparency, I'm best to get that on record.
Right, thank you very much. It is noted. Just check anybody else. No. So item 4, the minutes. Hopefully you've all seen the minutes. Are there any comments on the minutes, or can we take them as read?
Take them as read, Mr. Chairman.
Okay, I see no comments on that, so I'll take them as read. The action sheet, I'd just like to highlight that the action sheet has been slightly on hold due to the COVID emergency. So it is going to be worked on again very shortly. Does anybody have any comments you want to highlight on the action sheet that would like us to note at this moment in time? Okay, in that case, I'll take that. Youth, item 6, the Youth Justice Plan. So this paper is required to go through Children's ONS and will progress to Cabinet and then Council at a later date. What we're looking for here is any recommendations to add to the paper from members of the committee. I believe David Webb and Jane White are to present. Just make a comment, if anybody else is watching this, the presentation is available as part of the pack, which you can find online rather than seeing it presented.
Thank you, Chair. Is it okay to present?
Please, Jane, please.
Okay, thank you. Just to introduce, the local authority has a statutory requirement to produce an annual youth justice plan, which provides information about local provision. The plan sets out our priorities for 2021 and gives a national and local youth justice context. I'd like to, if it's okay, to hand over to the service manager for the Youth Offending Service to present the plan and the report, and that's David Webb.
Thank you, Chair. I'll go ahead if that's okay.
Yeah, thank you, David.
As Jane said, the Youth Justice Plan is a statutory requirement. It has to cover certain content, so it sets out the structure of the Youth Offending Service, shows that we meet the statutory requirements of the Crime and Disorder Act in terms of the membership of the Youth Offending Service. It sets out our resourcing, and in it we talk about our performance over the previous year and our priorities for the year ahead. So councillors will have seen the Youth Justice Plan in advance. I'm happy to answer questions. The priorities that we reached at the end of the plan are based on a combination of local issues, national priorities, self-assessment, which we undertook as part of the Youth Justice Board, national standards self-assessment, and discussions with our staff, stakeholders and service users. And we recognise that we work across a wide range of topics. So there's plenty that we could have put in our plan and made our priorities, but we clearly need to try and focus. So the 5 priority areas, not to say that we won't be doing other things as well, are to reduce first-time entrants into the youth justice system, to try and reduce the overrepresentation of Black, Asian and minority ethnic young people in our local youth justice system, to improve the planning for when the small number of young people who go into custody for their release arrangements, to reduce the chance of further offending. Child exploitation and youth violence is a topical issue nationally, and we have seen evidence of that locally. So that is a priority area for us, and we are in the process of implementing trauma-informed practice to become a trauma-informed service, which helps to work with the issues that those young people are likely to have experienced in earlier life. And it remains an issue for us that young people in contact with the Youth Offending Service struggle sometimes to access the right education, training and employment. So we've maintained that as a priority area for this year.
Okay, thank you very much. Do any councillors have any questions? Sandra Moore. Sandra.
Okay, thank you, Chair. Obviously, I've got to take this paper on to Cabinet and on to full council, I'm just confirming basically that I'm going to take all the recommendations from this meeting. We'll go on to the Cabinet meeting. But can I just ask a question about the resettlement planning and the safety of young people coming out of custody? I mean, clearly finding the right accommodation for these youngsters for their release after their release from custody can be difficult. And the report mentions that sometimes this isn't resolved until very close to the release. My question is basically whether or not this council should be helping or could do more to help with this sort of situation. Is this something that we can take forward and try to help with? Thank you.
Shall I answer that, David? Okay, just to say, I mean, the planning for young people coming out of custody can sometimes be problematic in relation to some of the behaviours and challenges. So finding an appropriate accommodation or placement for them isn't without its challenge. I think it's about tight, effective planning at an early stage to consider the needs of the young person, and for YOS and social care to be working really closely together in advance to plan effectively. And I think we've got success stories, and there are times when it's really difficult, and it is a last minute, we've finally found something. So I think it is about David and myself ensuring that we're working really closely together with our placement finding team if the young person needs to go into a placement, or working with the family if they're going back home or with family members.
Thank you very much. Councillor Mike White. Mike, you requested to speak.
Yeah, thank you. Sorry, I'm trying to unmute. Yeah, David, it won't surprise you if I come back on the question on first-time entrance to the system. I mean, I've watched this presentation annually from you for several years, and Poole and Bournemouth really have been outliers for some considerable time relative to both national and regional, which is obviously disappointing. I mean, it seems we're not really getting on top of this, and I'd appreciate your take on what we're missing out on and what's actually going to change. Thank you.
You will have seen, I think, in the report that actually that has been a concern for us. You're right, and we have talked about it in previous meetings. The rate of first-time entrance locally has reduced for the last, I think, 4 successive quarters. So things are heading in the right direction. When we compare ourselves to the regional and national average rates, those rates have also been reducing. So we're narrowing the gap, but we haven't quite got back to the regional average yet. But so our rate locally is lower than it was 2 years ago, quite considerably. The kind of bigger picture for reducing first-time entrance is that it really requires a coordinated approach in terms of early help and prevention services, but also once the young person is perhaps on the cusp of criminal behaviour, then we work closely with our colleagues in the police to try to work out what is the best response, recognising that criminalising a young person can be counterproductive. We don't want to label them as an offender prematurely, but we do need to make sure that the right support services are in place. So over the last year, we reviewed all our decisions on what we call out-of-court disposals, which is the lowest kind of entry level into the justice system for 2018-19, and we're satisfied that we've made the right decisions. Each decision is the result of a consultation between the Youth Offending Service and the police, and we seek information from other services such as social care and early help. And the Police and Crime Commissioner has a quarterly scrutiny panel of out-of-court disposal decisions, which almost always uphold the youth decisions. So we feel that we're making justifiable decisions, but we're also keen that we can try and expand the use of informal options. So the police, working with the police and with ourselves and with other local services, including our young people's drug treatment services, we're just implementing a wider sort of set of options for possessed cannabis offences, which sometimes young people might have an offence of possessed cannabis. If they get stopped again for another similar offence, that may lead to them getting a youth caution. We're looking if we can find ways to provide support and intervention to stop the drug use without necessarily applying the youth caution. That was due to commence in April. It was slightly delayed by the COVID-19 lockdown. So we're getting that underway now, which we hope will just be another sort of plank in our overall strategy to reduce first-time entrance, and we will also be looking at other offence types to see if we can do something similar with other offences.
Right. Thank you very much. I noticed that Judith, you put a request to speak. Is that to follow up from this?
Thank you, Councillor. That's very helpful. Yeah, I just wanted to support what David said. I sit on the YOS board, and we did ask the YOS team with partners to review the first-time entrance decisions, because as the YOS board we were not content with, as you say, Councillor White, that when you look at the data, we are an outlier, and although there's movement elsewhere and movement here, the disparity is still there. I completely support David's view about ensuring that the local authority offer in the round is brought to the benefit of individual children who are on the cusp of entering the criminal justice system, and by that I mean making sure that the adolescent services that are available for young people are absolutely available to young people that will come to David's attention, because we need to work as one system and one team and move away from siloed based ways of working. I do think that the whole partnership, so that's police, colleagues in probation, social work, health and the like, are committed to work together to bring in what is best practice elsewhere, because first-time entrant models were starting to move significantly in some parts of London in a different way a while ago. And I think that we're well placed to start to make a difference over the next 12 to 18 months by virtue of the expertise that we've brought in, specifically through the lens of exploitation of young people, because that enables us to start to see young people who have come to the attention of the police and the YOS because they are committing criminal offences. But I think the learning that we've started to bring into the system enables to see some of those young people, quite rightly, where appropriate, as victims of criminal activities, which then have led them to commit some criminal acts themselves, because they are being exploited and need to keep themselves safe, and at that point, in that moment, they think that's the way to keep themselves safe. We are looking to improve our practice, and I think it will have an impact in this area of work as well. And we're currently reviewing that model through the lens of 2 individual children who did receive recently custodial sentences, to think, could we have done things differently by bringing that learning to bear? So I think it's something that we should stay on Overview and Scrutiny's committee. It's certainly on the YOS board's commitment to see a difference, and I just wanted to support what David is saying, put it into the wider context that we're committed to not work in silos. And also this idea that we need to, and are committed and have started to bring learning from other systems for the benefit of children here.
Thank you very much, Judith. Are you happy with that, Mike?
I'm grateful for the response from David and Judith. I was just going to suggest that rather than wait perhaps a full year to see the next set of figures, perhaps we could have an update specifically on the entrance to the youth justice system in perhaps 6 months' time, to hopefully reassure ourselves that we are gaining traction here. Thank you.
That sounds perfectly reasonable, Councillor White.
Chair, if I could just add a comment. We are having some issues with the national data. You may see in the youth justice plan there's a quarter where it appears to go down to 0 because the data wasn't published. So the frequency of the data being published may be an issue, but we can also use local data, which will be slightly different, but will have a similar trajectory.
Yeah, thank you very much, David. That was one of the things that I'd noticed. I was going to ask you about actually later on, because it makes the graph a little bit confusing, doesn't it? I believe Councillor Lisa Lewis. Lisa, I think you asked to speak.
Sorry, yeah, just getting started. Looking at page 14 of the report, I was wondering, seeing the graph with the rate of first-time entrants going up for our area, but down for the others, this does seem to coincide with a reported lack of funding. And I wondered if this was causing the problem, making our service less effective. I think you have actually answered some of my question to Councillor White, so thank you. But I was just wondering if the lack of funding, if there was any connection, and whether this was actually a problem or whether it was being overcome.
Just in terms of the youth offending service response, in some ways the first time entrance data reflects the resourcing of other services rather than the youth offending service. We become involved at the point that the young person enters the system, and thereafter if they reoffend. We have, in terms of our own resources, successfully managed a reduction in funding over the last 5 years by virtue of partly of having a pound Dorset arrangement and having the resilience and avoiding cutting out some of the duplication that used to exist with 2 separate services. So we've managed our resources well to cope with reductions in funding, and I wouldn't attribute our performance to a resourcing issue. we have seen a reduction in the first dimensions. The trend is coming down, but it's not coming down as fast here as elsewhere. But the gap's kind of narrowed, but we haven't quite caught up with other services yet.
So do you feel you're able to manage the situation? I mean, have you got it in hand? You've got plans?
Yes, as Judith Ramsden was saying, the key thing is for us not to work in silos. So we are very closely linked with the new complex safeguarding service, with the new early help arrangements, as well as children's social care. So when we're trying to make decisions about what is the right way to respond to an individual child who's committed an offence which is at relatively low level and therefore potentially could be dealt with outside the justice system, what we're trying to do is make sure that the support from other services is in place, and it doesn't necessarily need the youth offending service to get involved at that stage, which is better for the child and a better use of public resources.
Sure, thank you. Thank you.
Thank you very much, David. I think it's Councillor Rachel Marchant. Rachel, I think you asked next.
Thank you, Chair. Obviously, I've got some experience in terms of the National Probation Service, and I've worked alongside the Youth Offending Service. In terms of it was page 41 on my papers pack. I'm not entirely sure what page it might be in the report, but there was a note about resettlement and transitions, and I didn't see any mention there of transition to the National Probation Service. And knowing the types of offenders that are likely to fall into that bracket, you're likely to be looking at those who are with the service that much longer. I was wondering if you had any information about the numbers that are eligible and the numbers that are transitioning at all.
Yes, I can answer that. Obviously, we do see some young people who go on to commit offences as adults, so therefore they become the responsibility of the National Probation Service or the Community Rehabilitation Company. In terms of the numbers that actually transition, in the sense that during a justice sentence they turn 18 and we hand them over to probation for probation to take on the supervision, I don't have the exact numbers, but we're talking single figures each year. So when a child turns 18, we would decide how long there is left for us to work with them, their level of maturity, and therefore their ability to engage with being treated as an adult, which obviously is the MPS and CRC approach, and other factors, and come to an agreement with MPS and CRC as to whether we transfer the case at the young person at that time, or whether we might supervise them to the end of that order. I think a bigger issue perhaps is young adults who commit offences without being current to the youth offending service, but perhaps at the age of, say, 19, having previously been known to us, and whether we've got the right arrangements in place in terms of information sharing so that the probation assessment incorporates information from the youth offending service. We do have a seconded probation officer in our team. As councillors may know, we're a multi-agency partnership under the statutory requirement of the Crime and Disorder Act. A part of the probation officer's function is to oversee the transfer of cases, so converting a youth offending service assessment into a probation assessment, and making sure that we've got the plan in place. So we will do handover meetings for the cases that we hand over, but I think we can still keep working at handover arrangements when it comes to probation as a new offence at the age of, say, 19, and we've previously known that young person.
That's really helpful, thank you. I certainly think it's an area of work that perhaps doesn't get as much credit as it could do, because there are a range of people whose maturity is just not there for them to turn to an adult service, because there's such a stark difference between the child being at the centre of the service with the YOS service, and then ROSH and risk of harm to the public being at the centre of the probation service. And I think take credit for that work where you continue to work with somebody beyond 18, because I think it's actually, for many of the people that you're working with, it's absolutely essential that you keep that young person at the absolute centre. So that's really positive to hear. Thank you.
Okay, thank you very much. I think Councillor LJ Evans. LJ, you had a question.
Yes, thank you, Chair. I've got a couple, so I'll just do one and then come back with the others later, if that's okay. We've got lots of data about breakdown of prevalence with respect to speech and language difficulties, but I was just wondering, do we have any data on prevalence of mental health disorders, and is there any way we could actually collect that, and would it be useful?
I don't have a statistic that I could give you straight away. We do have seconded CAMHS nurses in our service as part of, as I mentioned, we're a partnership arrangement. And what we do find is a significant number of our young people have some form of emotional and mental health difficulty that may well fall short of a formal mental illness diagnosis. But autistic spectrum disorders, ADHD, and more broadly, early trauma and developmental trauma from poor attachment in the early years, that is a really significant issue for us. So that is partly why we are following Youth Justice Board advice to apply the enhanced case management model, which effectively means understanding how the child's early experiences, which may well have involved trauma such as witnessing domestic abuse, parental loss, physical abuse of the child, those early experiences have an impact on brain and emotional development, which inform the way the child behaves as a teenager, potentially committing offences, coming into contact with our services. And what I think I would say is that whilst we may not have that many who have a formal mental health diagnosis, we have a significant number who have problems across a range of areas which cumulatively add up to a significant emotional and mental health impact on the child. So we are using our speech and language therapists to identify the speech and language needs. We have CAMHS nurses embedded in our service, so our practitioners can refer to them when they feel that there's a significant mental health need. And if the young person is working with CAMHS outside of our service, then our CAMHS nurses are able to access RIO, the CAMHS database, and facilitate the young person's engagement with the community CAMHS service. And sometimes the young people we work with haven't responded to the more conventional ways that CAMHS have delivered their services in the past and need a bit of help to access CAMHS appointments and other health services such as paediatrics, sexual health and substance misuse services.
Thank you. I completely agree. They may well not have a formal diagnosis, but that may well be the reason they've actually ended up in front of the youth offending services, because it hasn't been formalised and they haven't been given the help and support they need. So I'm just wondering if collecting data would actually facilitate that and make sure it's a high priority going forward.
I completely understand your point, Councillor Evans, and I'm happy to seek to collect the data more actively.
If I may just add to that, I mean, and David and I can take that away and look at how we can effectively collate the data through the YOS assessments that take place as a starting point.
Thank you, that's really helpful, because it struck me earlier, someone said we don't like to criminalise people, but unless people have labels, they often don't get the help and support they need. And I think it's often the case with mental health. So thank you for actioning that. I'm very grateful.
Thank you very much for that. LJ, did you have a second question, or has that all been covered now?
I do. Sorry, I don't want to take up everyone's time too much. So it's just a couple of things. Firstly, do we actually have any ex-offenders working within the multidisciplinary teams or on an informal basis with people coming into the system? Because I know in adults that can be very helpful when people have got a lived experience to help prevent others going down a similar path to them. And as part of that, we did have service user feedback, which was presented in the positive light of 56% didn't want any changes, but that means 44% do want changes. That's not a great feedback, and I'll be interested for your comments on that as well. Thank you.
Thank you. It's a bit delicate to answer the question about whether we have ex-offenders amongst our staff group, but we do have people with experience, with similar childhood experiences in our staff group who have gone on and undertaken training and can apply their past experiences alongside their kind of professional training that they've had. And the feedback, I've tried to list in that subsequent to the 56% comment, are just some of the comments that are the things that people wanted to change. There was things like how long the appointments were for, the timing of appointments. Not, I would say, a kind of substantive change to our service, but definitely things we want to pay attention to in terms of making our service as accessible as possible. So I mentioned earlier that the traditional CAMHS model, which perhaps is a bit unfair to characterise that as still being the community CAMHS model, was quite clinic-based. We take a very different approach. or we did until COVID-19 struck, of doing lots of home visits and really being responsive to where the child lives, seeing them in the home situation at times of day that suit them. And that was some of the sort of feedback we got about making sure we continue to be responsive to their needs.
Lovely, thank you. So it was all just sort of minor little tweaks and things they want, rather than there's a major problem going on here that we need to look at.
That's right, and especially given the fact they didn't ask to work with us. That's reasonably positive feedback.
That's a very good point. Yes, thank you.
Okay. Thank you, David. Thank you, LJ. Does that answer your questions?
It does. Well, I've got another couple, but I'm sure other people need to speak. So.
Well, I just want to check. I think Jane Kelly, I think your question's been answered now, hasn't it?
Yes, that's right, Chairman. Thank you.
Right, thank you. So Councillor Lisa Northover. Lisa, I think you had a question. Are you muted, Lisa? Okay, in that case, I'll come back to Lisa in a moment. I've just got a couple of questions which I can fill the time in with for a moment. I noticed your speech and language therapy, which I hear is actually doing some really good things and making a difference. Could I just ask how we're ensuring that best practice and other novel approaches are being used?
The addition of the speech and language therapist was an example of us identifying good practice from elsewhere and then successfully managing to get resourcing for it. And it has made a really transformative difference to the way we work, mainly in terms of the way we understand the speech and language difficulties that young people have, both in terms of their expressive language and receptive. So they may well appear to understand more than they actually do. And our individual assessments from the speech and language therapist really help us respond individually to each child and help their family members as well. The trauma-informed practice, which is also mentioned in the Youth Justice Plan as a priority for this year, is another example of us identifying best practice from elsewhere. The Youth Justice Board have a national remit to promote best practice. So that is one source where we get advice and we can see what other youth offending teams are doing. There's a resource hub where good practice is shared. And then there's also HMI Probation are the inspectorate for youth offending teams, and they have an inspection regime which combines inspections of individual youth offending services, which those reports always have interesting ideas about good practice they've found or areas that could improve, and a programme of thematic inspection reports, which is also really helpful in terms of identifying and promoting good practice. So we're open to good practice, and hopefully the addition of the speech and language therapist 2 years ago, and now the programme of trauma-informed practice are examples of how we try to keep developing whilst maintaining our kind of normal practice standards as well.
Okay, thank you very much for that. Let's check, Lisa, are you able to ask your questions yet? In that case, we'll come back to LJ. I believe you have one more.
I'm so sorry, I really didn't mean to take up everyone's time so much. Early on in the report, you mentioned that you've managed to balance your budget, and actually in your reply to Lisa, you spoke very well about how you've managed to do that without cutting services. Obviously, with respect to COVID, the council as a whole is now expecting quite significant budget pressures. Are further cuts, well, further cuts presumably are likely, and what are we going to do to mitigate those, please?
I recognise the significant financial pressures on the local authorities as our main funding partners alongside our Youth Justice Grant. So I am, and I've put a line, I think, in the report to accompany the Youth Justice Plan, noting the significant pressures that local authorities are facing. So I am expecting to work with the YOS Partnership Board and the local authority directors to look at our resourcing and to think about how we can potentially absorb further reductions. And I do think, though, that with the structure we have in place, sharing services across 2 local authorities does enable some of the statutory requirements of a youth offending service not to be duplicated. So if we didn't have that, we'd be doing 2 versions of the same thing. So we're already quite efficient, I think, on that front, but I think we do have the resilience to absorb further reductions. And I think we need to look at, in that context, how our working practices have changed as a result of the COVID-19 lockdown. We've seen an increased use of remote contacts with young people. We balance seeing young people face to face, obviously with appropriate safety measures in place, with seeing them virtually, either by video or phone. There are limitations to working remotely, but there are also some young people who do respond quite well to that, and a blend of the two is probably the way forward, which potentially releases some resources. Equally, our staff, like other children's services, have worked from home pretty much from the start of the lockdown. So there's a reduction in staff travel, is an obvious potential financial saving, as well as being a benefit to the staff individually, because it's saving them time, and the environmental impact of not having staff travelling around the area is also beneficial. So I think we can look at our working practices. I think we still have some resilience in our service structure that we can absorb the reductions which I recognise local authorities are having to confront.
Thank you, that's really good news, and it's amazing that there are actually some positive benefits to COVID going forward. So that's really good to hear. I suppose the problem with all these budget setting is prevention is essential in youth offending, but the council and the other stakeholders never actually see the benefits of that, because that comes out of a different pot of money. So I think it's really important that we do value the youth offending services and try and make sure we do get an adequate funding, even if we don't get all the money we're hoping for. Thank you.
Thanks. If I could just add a further comment, we're really aware of the local authorities' commitment to good prevention services, and the kind of good economic sense, as well as the kind of good practice and the best interests of children and families to put the resources in early enough to prevent problems developing. We've also, in the youth justice system, got some opportunity. We've got young people who are awaiting court appearances, where the court process was already slower than we thought it should be, which is something we've been trying to address in the last year or two. That has been further delayed by the COVID-19 situation, with the courts not operating for several months. So we've now got a chance, I think, to be a bit more creative about how we get involved with young people earlier, before we've actually got our formal YOS remit to get started, which in a way will be that kind of prevention work. We need to go towards the work rather than wait for it to arrive at our door.
Thank you very much for that, David. I think, yes, Councillor Jane Kelly. Jane, you've got a request.
Thank you. I was just wondering, David, one of your priorities is to address the overrepresentation of BAME young people and children, and I just wondered how you could go about trying to address that, because surely you are presented, either children and young people are referred to you or present to you, and whether they're BAME or not isn't something you can control. So I wondered how you could address that. Thank you.
It's a really, you're right, so it's a difficult and complex issue. David Lammy, as you may well know, wrote a review of BAME over-representation in the justice system, youth justice and adult justice. I think it was 2017 it came out, with a reform or explain kind of message, recognising that there was significant over-representation. But he also recognised, I think, that in a way the over-representation in the justice system is the end of a cumulative road of disadvantage. So we will see potentially over-representation in maybe school exclusions or access to mental health services or other forms of disadvantage. So it's hard for us to tackle it on our own. That's what I think is one of the things I'm saying, that it needs to be a more system-wide approach. I think in the last year or two, what we've tried to do, and I think with some success, is make sure that our processes at the early stages of the justice system are operating fairly. So we have occasionally, if we've identified that a young person from a Black, Asian, minority ethnic background has gone to court for an offence, we've sometimes challenged that with the police and said, you know, is that right? Should they not have been considered for an out-of-court disposal? The police are very alert to those issues anyway, and to other forms of disadvantage. So I'm hoping that active approach at this stage is reducing the early entry into the system. One of the things that David Lammy identified was that there may be a cultural reluctance to admit guilt because of lack of trust in services such as the police and probably local authority services. Without an admission of guilt, you immediately disqualify yourself from the out-of-court disposal options, which effectively puts you further up the ladder. So I think we're trying to address that as well with the police. We're also, so some of the overrepresentation that we see locally is in young people going into custody, which is a very small number at the most kind of extreme end of our justice system. Most young people commit relatively low-level offences, get low-level disposals, and we don't always, we don't see a lot of them again. Also, young people getting arrested and spending time in police custody is another issue where there does appear to be some overrepresentation. Locally, that issue is, in terms of the representation for our local population, we could recognise that young people arrested in the BCP area may not come from BCP, which in itself is a separate issue in terms of how we support those young people. So the later stages of the justice system are where I think we're seeing the overrepresentation. We're taking action at the earlier stages, and I'm hoping that will filter through, but it's not going to happen straight away. But I also think we need a more system-wide approach which goes beyond the justice system and has that BAME lens on all aspects of, I guess, children's services and probably other services as well.
If I could just come in there, because I believe because Lisa Northover was having problems with the microphone and she was going to ask a very similar question about BAME, and I also had a sort of not a question but more something I've noticed. 50% BAME in youth offending data, and yet we've got about 6%, I think, within BCP, which sort of it sort of shouts out at you. I'm really pleased to hear that people are asking questions about this and struggling to come up with answer. Judith, I believe you wanted to come in on this as well.
Thank you, Chair. I think my reflections were going to be the same. So I think that you've shared the sort of disparity of data and position that I was going to highlight. It shouldn't be a surprise to us. As David has said, he set out recent research which has been championed at national governmental level. This disparity of the experience of young black people or BAME people has been in the system and society for many years, and as David said, it often is evidenced in which children are subject to child protection plans or come into care, which children are excluded from school, and which children and young people and then adults are within the criminal justice system. It is of interest to us that through the lens of the Learning Partnership and work that we've been doing with educational leaders, we do have also some interesting hypotheses about labels and views about vulnerable boys in general, and a potential, because we're exploring a hypothesis, a potential disproportionate number of vulnerable boys being educated and therefore with some label around SEND schools. So I think that there is a question about unconscious bias within professional groups as well as society. We could track that and be curious about that in terms of calls that constituents make to police about which young people are causing trouble and or having group fun, and how does that lead to responses from different agencies and different private sector companies. And I know that as a public sector body with partners in the police, we are all committed to identify and help professionals at every level start to recognise the impact of unconscious bias on decision making. I think it's something we should stay close to. I do think some of the best practice models, going back to Councillor White's question around first-time entrants and best practice around diversion from entrance into the criminal justice system, I think some of the best practice models have come from very diverse areas, and they have started to make some changes in regard to over-representation in the criminal justice system of kids from a BAME ethnicity background. So I think I welcome the questions, as I know David does, as the YOS board would, and keen to stay transparent about impact and changes we're able to make with our partners in the police, probation and the community.
Thank you very much for that, Judith. I think we were about to move on from this item. I just wanted to share one thing with you, because I did ask a question about the number of young people in care, because that gets mentioned on the paper. I have got an answer. I can't share it because we might be able to identify people from but if anybody's interested, please contact me and I can share that with them privately. Just to summarise then, I feel that we're still worried about the fact that the area might be an outlier, but we are doing some work there to try to rectify that. We think the mental health data would be very useful, and we've got a discussion about collecting some of that data. I think we're very keen on trying to get the work between 18-year-olds and older people to be seamless. I hear quite a lot of information about good practice has been shared with us, and new and novel practice. And we had quite a discussion about BAME, which I think is a worry to all of us. So I think we've had quite a good discussion there. Thank you. The next item is item 7, update on the COVID-19. This is one, we're taking over this now from the ONS board. I've been to the ONS board and asked questions on behalf of you, and thank you for those of you who share questions with me to take to the ONS board. I've looked at this paper. A lot of this is quite, I've seen lots of this before because I've been to the ONS board and I've also been in briefings. So really I'm looking for you to ask a lot of questions on this from things which you might notice. I'd really like to focus on what young people's experience and what young people are telling us, if anybody has any experience on that. Any questions? Oh, sorry. I think Neil, Goddard, Jane and Julian are going to present some information on this.
Thank you, Chair. Sorry, it's Neil Goddard here. Yeah, this is quite a long and detailed report that hopefully gives members a good oversight of all aspects of Children's Services response to COVID. And so I'll only do a brief introduction to it because, as you've already pointed out, I think the important thing is to be able to ask questions on what's in the report. But hopefully members feel this is a detailed overview of everything that we've been undertaking during the period of the COVID response. Like all services, COVID has a significant impact on children's services, and we've had to adapt our services to reflect that and make the changes quickly to ensure we maintain services, as you say, quite rightly, to children and people and their families. The report goes through a summary of some of the changes that we've made and talks about how they have impacted on our service. We have a weekly conversation with our colleagues from the DFE and Ofsted, and they also ask us questions about how we've responded, and we supply a significant amount of data to them to demonstrate the work that we're doing. The council the government put in place what they called easements, so changes to regulation that enable children's services and other services to change the way in which they work to reflect COVID, and they're set out in the report in each of the sections. So in education, health and care plans, for example, or in terms of the early years or adoption services and fostering. So once again, there's some detail in there about that, but like I say, trying to leave as much time as possible for questions. I think I would leave members to ask questions about that. We also talked about resilience as the next stage at paragraph 30 onwards. These are the things that we're doing to ensure that services are maintained. And as you'll see from paragraph 30, we have 68% of all staff available to the service, which is within the boundaries that we set ourselves as being manageable for the service. We then go on to talk about our response at paragraph 34. and the things that we've put in place, and hopefully that gives some examples of the things that we've done, particularly around children's experiences, such as the virtual offer from children's centres and the virtual curriculum from schools that we've supported as well. We've had a specific focus on vulnerable children, as it talks about in paragraph 37, and we've clearly done a huge amount of work with schools, as paragraphs 42 onwards talk about. It's worth noting again that all schools in BCP have remained open to support key worker children and vulnerable groups throughout the whole of the lockdown process, and the number of children attending has steadily and consistently increased as they continue to provide a really good offer for those children. Schools have worked really hard throughout this process, and I think deserve our thanks for everything that they've done in supporting children and their families. We then talk about some of the partnership work that we've done around police and safeguarding, and then changes that have happened as a result of COVID, perhaps. And so it talks about contacts to the front door remaining stable, but other changes happening within the service. We then get a little bit about what feedback we're getting, and I think that's important in relation to your question, Chair, and perhaps you might go through that later. And then we go into our plans for recovery, and there's some quite detailed plans here, but as members will be aware, the context environment in which we work changes rapidly. So you'll have seen the sort of announcement about schools and what might be required of them in September that came out very recently, and so that once again changes what we might be expecting to deliver in September. So as I said, I only wanted to give a really brief intro to this to enable maximum time for questions. I hope that's a good approach, and unless any of my colleagues would like to add to that, I think we can ask members if they have any questions about the report.
Thank you very much, Neil. Are there any of your colleagues who want to add before I move on? In that case...
sorry, I just wanted to say no, thank you. I think Neil summed it up very well.
Yeah, I agree.
Great, thank you very much. Now, I believe Adea Brandon, I think you're the first person to ask a question on this.
Yeah, thank you, Chair. So obviously, being a young person, I know very well about how COVID is affecting me and my fellow peers, and we've had many forums with some psychologists, this child psychologist, who was telling us about COVID and how it's impacted us, and we've done some surveys online for Youth Parliament to get an overview of how young people feel about it, especially about how Year 10s and Year 12s feel about it with their exams approaching next year. And the general consensus is that they were quite anxious in a sense of how they would be supported when they go back to school, go back into normal life. Like what will be the difference? How will they be supported? Will there be extra classes that they can attend so they can catch up? And especially students who haven't been keeping up with their work, how can they make sure that they are supported and they get to catch up? And also regarding like PHSE during this time, with well-being as well. I know there's many schools which haven't supported their pupils with mental health or pastoral care, for example. So how can we, as a council, make sure that happens? Thank you.
So, Chair, it's Julian Radcliffe here, Service Director from Inclusion Family Services. Perhaps I can pick that up in part.
So thank you, Julian. That'll be very helpful.
So, Adea, thank you for your question, which is very pertinent. So, there's quite a lot of discussion around some of the challenges children and young people might experience as they come back to school, and the local authority tried to pull together a series of strategic and operational responses for our schools more generally. But I suppose, to be clear, each school will adopt their own approach in how they choose to respond at any moment in time, because schools are individual autonomous organisations. So in the first instance, what the local authority has done through its psychology team actually is put significant resources with schools in terms of understanding the best approaches to supporting transition back into school more generally, because transition is often complex in any case. But in particular when children and young people, and particularly more vulnerable ones, been off school for quite a significant period of time. And actually I'm going to put specific focus on children and young people who might have low levels of anxiety, who haven't been exposed to school. The research would tend to say that if children begin to experience a level of anxiety leading to non-attendance, then actually it can be quite hard to get kids back in school more generally. So we shared an awful lot of resources through the education psychology team to make sure that schools understand some of the challenges that children and young people may experience coming back to school and feel confident to be able to support those children as they return. In addition to that, we're quite mindful of the fact that there may be an increase in challenges for children coming back into school, and we're going to maximise and release the resources that we have within our broader gift to all schools in September, because there could be all sorts of peaks of challenge in a number of areas, and for lots of reasons, in part due to children and people not being exposed to school, not being used to it. But also there's people, young children losing their routine, their structure, and actually kind of struggling to adapt to the challenges, social, emotional, curriculum, other they might experience. And as part of that, or that was planned in any case actually, we're introducing for every school across BCP a team around the school model, which creates a multi-agency network of professionals to support all our schools and their communities at the beginning of each term, to understand as a system of professionals the kind of challenges that the children will be experiencing and the teachers will experience in supporting those children and young people, and to make sure that we have multi-agency responses for individual children, groups of children, groups of professionals who can support project work in schools where there are known, if like, clusters of difficulties. So, for example, if there are groups of children experiencing low levels of anxiety, for example, making sure that there are proper groups led by professionals to support a response in relation to those, to make sure that there are collectives of professionals supporting children who might be at increased risk of exclusion for whatever reason as part of the return to school. So I would say that's been pretty key to any response. But in addition to that, I think it's probably worth sharing that we have an increased presence in all our schools through the mental health support teams, who have a clear and distinct role to support a whole school approaches to promoting positive mental health and well-being. In the first instance, just for your information, that team, they will be part of the team around the school model I've referred to, but they will be supporting 17 schools in the first instance, which I appreciate isn't all schools. But on top of that, a second mental health support team has been agreed, which will double the size of mental health professionals working in and around schools. And they have a very clear and specific brief in relation to supporting children who are on the cusp of non-attendance in schools, whether that's through anxiety-led conditions or through reasons of exclusion, fixed term or permanent exclusion due to challenging behaviour. I suppose what I offer some reassurance for, and I've spoken at some length about this there, is that we're very excited in the fact that going back to school will create challenges for all sorts of children in all different ways. And we're really trying to flex the resources we have as a collective of professionals across the council and across health and partners to make sure children can get the best support and expertise they can at that time. I hope that answers your question. It was quite a long answer, sorry there.
Yeah, thank you. That was good. Thank you.
Okay.
Thank you very much, Julian. Jane White. Jane, I think you wanted to come in on that as well.
Thank you, Chair. I just wanted to add to what Julian's just been saying in terms of the team's work with our vulnerable children in relation to children who are subject to social care interventions. We've been reviewing and bringing forward the reviews of all children in need, all children subject to child protection plans, and children who are in our care, who are specifically year 10s over the age of year 11 and year 6s to help with their transition planning. We've been working with foster carers to try and support them, to support children getting back into school over this period of time, but also where they're not in school, how can we support them? So the reviews are addressing how we support them at this moment in time, and also what do we need to do to support them to get back into school.
Thank you very much. Just before I go on to the next councillor, Adele, did that answer your question okay?
Yeah, that was perfect. It's great to hear about the support plans which are going to be put in place. Thank you, Julian, and thank you, Chair.
So, Councillor Jane Kelly. Jane, you have a question.
Yes, thank you very much, Chair. I completely understand that the impact that this COVID thing has had on children's services generally. You've just had to completely work very, very differently, and it's been extremely difficult. I understand that, and you really seem to be trying to put everything in place that you can to help young people and their parents. I've been speaking to somebody, a resident, who has children with mental health disabilities and has friends in the same position, and they have been saying that where they're in the middle of getting a EHCP in place, it's been very difficult to get to a conclusion on that. And so they're kind of left in a limbo, and they really don't know if their child is going to be able to go to school in September, and various other problems. I believe that the phrase reasonable endeavour comes into it's about the easements really, I think, where, you know, it takes a bit longer to get to these things. The sentence that she's put in her email to me is, reasonable endeavour is not reasonable for SEN children. And I just wondered if you could comment on that, please.
So, sorry, it's Julian Radcliffe again. Thank you for the question, Councillor. So the phrase reasonable endeavours sits within the broader context of the easements that have been introduced through the coronavirus bill, which I'm sure you're familiar with. I'll do some wider context to that. As part of the coronavirus bill, the Secretary of State has signed off what are referred to as reasonable endeavours or easements in terms of the statutory responsibilities placed on local authorities and partners in relation to the whole EHC process, because it is a statutory process in terms of timescales and expectations that come with that. And as a result of COVID, and notwithstanding how we may individually feel about the reasonable endeavours position, there has been some really immediate impact on our ability to deliver on our statutory responsibilities, because you can opt in or out of easements and the reasonable endeavours model. But the nature of all EHCP working is that it's premised on people's ability to be able to work together and to secure the range of professional reports which would make up an EHCP at the end of the process. In particular, reports from health professionals, and in particular reports from educational psychologists, and actually from schools as well, to create a single holistic perspective of an individual child, which actually ends up being the EHCP document. And actually, the real challenge has been getting all the relevant professional reports collated into a single state, because a number of health professionals and our own educational psychologists have been able to do the work that's been part of them, either through the challenges of doing direct assessments for children and young people in lifetime, when there are challenges around social distancing, because it's a face-to-face assessment, or because, and particularly with health professionals, they've been redeployed or redirected out of frontlines back into a different type of frontline service, so can't do the work that's been required to complete what the ACP, or the Education Healthcare Plan. There's a degree of tension, and the question is well asked: is it reasonable or not? I suspect it probably doesn't feel very reasonable. But to coin a perhaps unhelpful phrase, kind of is what it is. And I think the challenge is making sure that parents, carers and children are well communicated with. And I think it's fair to say, because I don't doubt there are many councillors, members sat around this virtual meeting who would indicate that the communication from the SEND team who oversee the process could have been better. And I think I will apologise that to the panel today. However, we have tried extremely hard to maximise every aspect of our communication that we can with parents and carers working through the statutory HCP process, so they understand the challenges that we're experiencing, so they are able to accommodate their expectations around that. In terms of EHCP processes, it's sometimes suggested that children and young people, whether it's a delay in their EHCP being written, may not be able to go to school as a result. And I've had that shared with me a few times. And there obviously are individual cases where, in very, very, very rare circumstances, that may be the case. But actually, I would like to think that actually an EHCP being written or not should not preclude a child from starting school, for example, in September. And I have shared that with parents as well, who've raised that with me. It shouldn't be an issue. It becomes a little bit more complex when a specialist setting is being sought and a child is in a mainstream school. But again, I would offer some reassurance that wherever possible, we're trying to progress all those discussions and decisions as quickly as we can. Thank you.
Thank you very much.
Thank you very much, Julian. That's absolutely fantastic answer. It's about managing expectations, really, I think, and I totally get on board that you are working under very difficult circumstances.
Yeah, I think Emma Hall has also got a question about EHCPs, so I'll ask Emma if you'd like to follow on to that. Okay, Emma, just check that you've unmuted.
I'm so sorry. I spend all day on WebExes, and yet I always make that mistake. So I'm sorry. I was just saying I'm Emma Hall. I'm a parent representative rather than a counsellor. So just to follow on from that question, I have a question on behalf of all the children who actually have an EHCP already and feel that potentially the support that they have in school and outside of school has been taken away from them. Obviously, totally understanding the reason why and, you know, the environment that we're all working in. But what support is going to be in place to help those children catch up?
So, Emma, in terms of the number of children in and around school, we're talking about children, the HCPs in the first instance. Perhaps I could just state the efforts or reaffirm the efforts that the local authority with its partners have undertaken to try and get as many children and young people in school with complex needs. And in addition to that, some of the challenges that are linked to that, if I'm honest, it's not as straightforward as it might appear on many levels, and helpful or otherwise, and people can have views on this. Our figure of attendance for children HCPs has progressed up to 35%. You might rightly push back, that still leaves 65% of children not accessing school today. But actually, we've made really good progress in that respect. In terms of, if I can just go back to reasonable endeavours as well, before we move on, the reasonable endeavours does allow, again, it's complex in terms of how we feel about it, that the easements in relation to the statutory components from the HCP to be suspended in part for a while, and that's just been extended today until the 31st of July. Parking that, I think our challenge looking ahead is how we do accelerate learning over time, and I suspect that'll be addressed in part on a school-by-school basis, because however you cut it, when we've surveyed schools and subsequently parents, it's the educational programme that is most difficult to deliver through the home. But within that as well, Emma, again, it's quite an emotive issue. Some of those challenges are linked to parents' occasional reluctance to deliver programs and or challenges in delivering themselves, but also a reluctance for those parents to put their children back in school. So as we look ahead, what we've arranged actually next week, because we're unclear week on week what the arrangements will be for September 2020, when children will hopefully more routinely be going back to school. We've arranged a multi-agency meeting involving schools and health partners to understand, first of all, the extent of the challenge for children going back into school in September in the first instance, and that's in terms of the health components of ACPs as well as the educational programmes, with a view to understanding how the system may, subject to decisions made around social distancing in September, have to reorganise how services are delivered. Because if we continue to do what we've always done, and as we in some respects done for the last few weeks and or months, there will still be some children not getting their full entitlement. I anticipate, so there is something about looking at how the system organises itself now and will organise itself in September. However, in addition to that, there are opportunities through the government funding that's been confirmed to provide catch-up tutoring. I'm sure you've seen it advertised in around the media. And that is something that schools will receive additional funding for, with a view to determining how best to organise their teaching arrangements and or tutoring arrangements in line with individual needs of children and young people. I suspect with children with most complex needs, that those possibly in special schools, that they will be best placed to determine how to realise that so it has maximum impact. I'm going to stop there for a minute and see if that answers your question. I've walked around it a little bit, and I may seek a view from Neil, who may know a little bit more about the additional tutoring programme, but I'm putting him on the spot a little bit there, unless you're happy with my answer, Councillor.
I'm happy, yes, thank you. I mean, like, it sounds like you have a plan, and I guess for all of us it's a wait and see. So thank you very much.
Okay, thank you.
Thank you very much for that answer, Julian. Councillor Nisa Northover, let's see if your microphone works this time, because I think you have a question.
Okay, does it work?
Yes, it does. Hearing you loud and clear.
Thank you. Apologies then if my question has been answered while I was briefly offline. But I know anecdotally that some children have actually thrived during this time being away from school because they just have so many problems, anxiety, just really dislike school. And it also says in the report that some children feel that they have actually done better and had improvements in their learning. And I wondered if in the future we could have something that is a bit more flexible, that allows children to some sort of half homeschool, half in school arrangement, or just something that means that they don't have to do this going to school, which can sometimes just be really, really distressing and doesn't really actually achieve anything anyway, because they then come out of it with very little anyway. Thank you.
Thank you, Councillor Northover. It's Neil Goddard. I think you're right. I think there's a lot of lessons to be learned. Schools had to respond very quickly to establishing an online curriculum and an online offer, and it took a while to step up, but they really took the time to learn from best practice and to share good practice amongst themselves. And as you say, some children have found that a really accessible way of learning, that they've got the freedoms of not being within the school environment, but accessing online support and support from teachers who continue to contact them to support the online offer that's being put in place. So I think all our schools would agree that there is lessons to be learned from that and how we continue to use that into the future. Clearly, we work very hard to ensure as many children can access school as possible, and the benefits of accessing school in terms of social and other benefits for the vast majority of children are well recognised, and we'd want to continue with that. But I do think as we look to the future, and perhaps as we look to adapting the curriculum to meet the needs of children who aren't thriving in school in the way that we would like them to do, I think we have learned some really valuable lessons about what works as an online curriculum and what support is required from teaching staff and others to make that as accessible as possible and ensure that it is having outcomes and isn't just an offer that's in the internet space, that only those children who are motivated in their own way to access that actually children do want to access it and work with the school to continue to engage with their education offer. So I think you're absolutely right to identify that that this is an opportunity in looking at what the future of a broader curriculum that meets all children's needs might be. And as you say, some children have really thrived in this environment, and that's a really positive thing to see. And I know schools have reported a similar experience back to us. So absolutely, we want to continue to work with that and make sure that this isn't a one-off event that we put in place or schools put in place to address an issue, but there are lessons about the future, and I think that's really important.
Okay, thank you very much for that answer. Lisa, does that answer your question?
Yes, thank you very much, Neil. That's great, thanks.
LJ, I believe you have a question next.
Thank you, Chair. Firstly, yes, I'd like to absolutely agree with what Lisa, Councillor Northover and Neil were just saying about learning we can use going forwards, about having a different offer. School doesn't suit all children, certainly, and if we can take the best of what we've been doing during the COVID crisis, that's absolutely fabulous. But as Neil also said, a lot of children really do benefit from being in school. Julian touched on our numbers of vulnerable children who are actually in school at the moment, and they are pretty low. I'd really like a bit more information as to why that is and how we're increasing those as much as possible, please.
So thank you, Councillor. So I agree that when you talk about, when I talk about 35%, that sounds low. The phrase I've often used is that we're actually an outlier in the right direction. So frustrating though it is to talk about percentages of 35%. If you do kind of local, regional comparisons or even national comparisons, our level of attendance for vulnerable children is really high, which may be reassuring or not, I don't know. The challenge of getting more children into school is few. There's not a statutory requirement to in the first instance, so there isn't the, if you like, the leverage that will come through statute to say you must get your child in school. It sits broadly within parental choice at the moment, subject to DfE guidance. So that's the first issue. There's an issue of capacity in school, by which I mean physical space. I'm sure you're aware that there's only so many children that can be in school at any one time due to the bubbles model that's being used. And somewhat frustratingly for us as a local authority, we're really trying to assert around school attendance. We find ourselves in a position where a school will say, if too many children were to come into school at any given time, then the amount, you can increase the numbers, but then the offer for individual children goes down. So, whereas you might have 5 days of X amount of children coming in, if you increase X by a little bit, the offer goes down to 2 or 3 days, and there's a tension within that. There's challenges linked to workforce capacity in schools as well, in that there are a number of teachers and women across our schools who are shielding, which makes the numbers available to support children coming back to school challenging. And in addition to that, there are quite large numbers of children, particularly those with more complex needs, who are unable to social distance for a number of reasons. I'm talking children with quite complex needs, possibly health needs and or learning difficulties, but also children with challenging behaviour as well. And those 4 factors that I've referred to are kind of one of the reasons that actually getting our children's attendance in schools to increase at a more significant rate than it is, and it is increasing every single week, is quite difficult. But we have been really resolute as a local authority in terms of encouraging and working with schools and with families and creating connections between the two, to make sure that people are clear that it is right and proper that wherever possible and safe and responsible that children are going to school for lots of reasons, in part linked to obvious reasons with some vulnerable children, which are linked to safeguarding. Children who are sighted are safe, and if there are known vulnerabilities already, that's obviously in their interest, and that has been our initial and steadfast approach in the first instance. But of course, children who are in school are getting the kind of experiences we would hope and want for them in terms of curriculum, their enrichment, in terms of social experience, in terms of emotional experience, and actually just making progress on the kind of things that kids should be making when they're in school. To support this, and I've talked quite broadly around it, and the local authority right at the beginning set really clear expectations around school attendance and why we thought it was important. And we set that with parents and we set it with schools. And you may have heard me talk previously around releasing link workers from the local authority to every single school across BCP who had a clear, specific and unique role to work with the schools, to work with the parents, to make sure that vulnerable children in particular were enabled to come into school wherever that was possible. So in many respects, we have been, I think we've been really proactive and really successful in increasing school attendance. And as the landscape gently shifts over the next few weeks, we will continue week on week to seek increases in attendance by really vociferously asserting with our schools and with parents to try and get kids back in school where the resources allow it. I know that helps. I think I answered the question, Councillor.
It does, yes, thank you, because obviously these are our most vulnerable children and they need to be our absolute priority just for their own safety and ongoing development and all the rest of it. So yeah, that's really interesting that you're using other staff to actually help increase capacity, because I understand the school's problems over capacity and space, and absolutely the challenges of the social distancing, especially with relation to behavioural issues and learning difficulties. So that's really positive. What would a normal sort of level of school attendance be for this group, not in a COVID situation, just for comparison? Because if it's just sort of 40% would be attending school normally and it's 38 or whatever at the moment, obviously that's not a huge difference. So I was just wondering what the comparison figure was.
So and I'm doing this slightly off the top of my head, Councillor. We would ordinarily expect all children to be at school full time, but my recollection of children with complex SEND in particular, and or vulnerable in other ways, possibly linked to having a social worker, attendance figures are somewhere between 88 and 92% of the time. That's the level of school attendance. And that's because we would always aspire for 100% of school attendance, but sometimes these cohorts of children do present specific challenges and or circumstances which make full-time attendance difficult to achieve.
Thank you, but it is significantly worse at the moment than it
is.
That we can think of.
It is, but I think the greatest determiner for increasing attendance will be when we are clear on the social distancing requirements, which we hope will be considerably different from the beginning of September. That is the greatest barrier at the moment, without a doubt.
Lovely, thank you very much.
Thank you very much, Julian. Councillor Rachel Maidment, first I must apologise for you for using it earlier on. I believe you have a question, Rachel.
Yeah, firstly, I just want to say that the response of the children's services to the pandemic has been excellent, and so kind of a big thank you for the team for everything you've done for our vulnerable children. I also thought it was really positive to hear Mr. Radcliffe speak about those with complex needs, especially where social distancing isn't going to be possible when they return to school. The question I had was more specifically around the equalities implications, and I was just wondering if we've looked in more detail, for example, about the impact of those who have multiple or intersectional needs and or meet kind of multiple characteristics in the Equalities Act, because I kind of feel like we might be missing something by not bringing that out and being specific. So, for example, we know that the impact of COVID on BAME adults, BAME adult males especially, has been much greater. So I wonder if we've thought about something specific for that cohort, about what we will be able to do to support them when they're going back to school, for example, because they're likely to have a lot greater risk than other families. So it's just to explore a bit more around those equalities implications there.
Hey, Neil, do you want to come in there?
Sorry, I can do, Judith. I think Julian was going to comment as well. I think you're absolutely right about ensuring that we have visibility of those things. What we have throughout the process has been a huge amount of data, as you can imagine, to ensure that we understand how the impact of COVID is differential on each group. And we've worked with schools through the key workers that Julian's already identified to ensure that they have had the focus that they need. I think your question about the restart of schools or the return to school in September is a key one for us now. And as the regulations become clear, and as I say, they change or move on quite frequently, we absolutely do need to bear that in mind as we take it forward. At this point, it's difficult to say, and I think what we would hope, and what we experience, is that schools know their cohorts very, very well, and they understand the particular pressures that equality impacts may have on them, and we work with them to support that at an individual school level, an individual within the school level. So I think that is the challenge for us going forward, is making sure that what we put in place for the return to school addresses everybody's needs, because they will have experienced the lockdown and everything that's gone with it differently. And I think Julian's spoken about that in terms of the emotional and mental health issues that go alongside that, but I think equalities sit beside that. Julian, did you want to add anything to that?
Yes, just briefly, Councillor, it's an interesting thing, and you may have experienced this in your own world, I don't know, that the nature of the COVID pandemic is it raises an issue, and then a couple of weeks later you'll sit there and it kind of comes into your inbox a little bit, and you think, okay, that's a new issue that no one anticipated. An issue of COVID in relation to BME has been an interesting one. So this was raised with me a while ago, and actually we have shared guidance with schools, in particular in relation to the impact in the first instance of COVID for adults in schools, and we use that as a stepping stone. And we should publish some guidance. We didn't publish it. We adapted some guidance from elsewhere to make sure that there was a clear understanding across our schools in relation to the impact of COVID on BME groups, and we put some research in relation to that, actually, in terms of what it means for individual adults within schools and in relation to children and young people as well. Good practice guidance, and in addition to that, risk assessments to support that. But I suppose I would echo and build on what Neil was referring to, which is individual schools knowing their cohorts of children well and working out best how best to respond at an individual level, while being cited on the issues that are specific to a cohort more generally, and the cohort we've been talking about. Does that answer your question in part, Councillor?
Yes, it does. And I guess we referred there to the BAME issues because I gave a specific example.
There could be others, of course.
For example, LGBT pupils and staff are more likely to have been impacted in terms of mental health issues, for example. So it's just making sure we've got sight, and in a lot of regards that we're taking credit for the work that it sounds like is absolutely going on there, then having those specific bits perhaps under that equalities heading, so we can be really clear with that evidence.
Yeah, thank you. Points well made. Thank you, Councillor.
Thank you very much, Julian. I believe Emma Hall, you've got a question on summer schools for vulnerable children.
Yes, thank you very much, Chair. I just had a query on it's paragraph 57, where you talk about the fact that you're doing summer schools for vulnerable children. Can I just ask, obviously not all schools are going to be in a position to open over the summer. Have you got enough places for the children that are likely to want to take up that offer?
Sorry, Julian. I think we're still working with schools on what the summer school offer is going to look like. As you'll be aware, there is no national guidance that expectation that summer schools will be provided, and so there is a conversation about what a summer school is there to achieve. Because some teachers, some staff, and some pupils have been in school since January, you know, with no break, and absolutely there is a huge amount of exhaustion within the service. But equally, we need to make sure that everybody has the opportunity to go through the catch-up process and those other things. And we talked earlier about the tutoring resources that have come in for the autumn term, and that's very much where the catch-up focus is. Summer schools, I think, are around that transition back into school for us, how we can make sure there are activities that meet children's needs, but that has to, of course, be done within the confines of social distancing and everything that goes with that, and the regulations about what you can offer. So if the leisure centres aren't open, then that is a one option that's taken away. What we can say is that some of our schools have really positively moved forward with this and consulted with their parents about what they could offer, and made the offer to us to certainly offer that beyond their cohorts, which is really good. So we are very much in a coordinating role at the moment and in a communicating role, so that we understand what's going on and we can communicate that to parents. I think that's our role for the time for today, but that may move on over time. So we need to understand what the offer is, how we communicate that, and how that meets a particular need, without, like I say, putting additional strain on a system which has worked very, very hard. As I say, every BCP school has been open throughout that whole period, and we have to enable the schools to be ready for September, which is the absolutely key moment of pupils coming back into school, as has been mentioned a number of times today. So that would be my response. Julian, I don't know if you've got anything to add to that.
Just to add that. I agree with everything Neil said, obviously, and that our ambition is to have fully mapped all the possible opportunities to support children, young people, and their families, whether it's in a summer school, which is a pretty loosely defined term, I suppose, in terms of leisure activities, childcare opportunities, and we should have that published as a overarching BCP offer, which we'll put out through every social media platform known to us. We've got a few, whether it's through Send News, whether it's through Facebook pages, or whichever platform, so that those families looking to access something suitable can find it and can be connected with it. And we've also committed to making sure that we are assertive and proactive ourselves in reaching into those families where we know there are children who have vulnerabilities to make sure that they're connected into opportunities that are there. So yes.
Thank you. You've answered my question perfectly, and you touched on one of my concerns there, which is the impact on the schools and the teachers who have worked so extremely hard this year already. So thank you.
Right. Thank you. Jane White, you got an RTS. Was that about summer schools? No.
It was actually in response to the previous question around equalities, Chair, if I could just give a quick update.
Please do.
It was really just to inform the meeting that I have over the last few weeks been looking at our unaccompanied asylum-seeking children and reviewing the plans for them to ensure that they're being supported during this period and making sure that they have the right support in relation to the wider issues, but also including education. I just thought it would be helpful to feed that back.
Thank you very much. Yes, very, very helpful. Mark Saxby, Mark, you've got a question on MASH caseload.
Yes, hello, Mark Saxby, the diocese representative. Yeah, I was just wondering how effective the MASH teams has been during the COVID period. Has there been an increase or a drop off in calls coming in from schools? Are they at full capacity? Do we anticipate an increase in demand in the service when attendance starts to increase?
It's Jane White here.
Hello.
Just to say we are monitoring really closely the level of contacts and referrals coming in through the MASH. It has been at a manageable rate over the last couple of months, and we're seeing a slight increase over recent weeks. But the MASH itself has been effective. They're responding to contacts and referrals. You'll see in the report that there are concerns around domestic abuse, but we are anticipating over the next few weeks potentially an increase, and we're trying to plan to ensure that we've got the right resource in place to be able to respond accordingly.
Okay, thank you very much.
Thank you, Mark. Does that answer your question? Okay.
Yes, thank you very much.
And I've just, I don't think anybody else other than Sandra Moore wants to comment at the end. I've just got this one sort of more observational, well, it is a question really. I noticed that we've got 5 Ofsted inspectors and 4 social worker supporters have joined us. It's always a risk getting other people in from outside. I would suggest, especially if they're Ofsted inspectors. Has that support been useful?
So, do you want me to start, Chair, and then my colleagues will take a view? So yes, we have had 5 redeployed Ofsted inspectors. It turned out we had 2 social workers from the National Re-Registration Scheme. 4 were interested. We landed on 2, and we think that the capacity has been useful because we've had about 7% of our workforce who are vulnerable and or shielded. We had an ambitious and needed improvement and change programme set out before COVID, which needs capacity and focus, and therefore some of the redeployees from Ofsted have absolutely helped make the system, which was a new system anyway because of COVID, but a new system for us because we were an emerging team. Don't forget, at the start of the pandemic, we still had the predecessor council designs of early help because we were at the start of a restructure process. And therefore, initially, the redeployees were focused on setting up a new system for the benefit of key worker and vulnerable children, to support our teams, make sure that they could get back to school and the arrangements were working across the whole system. And they've done that with our own staff extremely well, and we can see the impact of that as Julian set out in the numbers of vulnerable children and the capacity in the system for key worker children that has been delivered and has increased week on week since the start of the pandemic. I think that we've recently been refocusing our extra capacity to support practice improvement in line with our learning improvement plan. And I think that Jane and colleagues have been leading that, so that yes, they are external support, but they are deployed in line with our quality assurance and learning framework, so that we enable our frontline practitioners and managers by learning through doing. And we're really delighted to have been able to welcome in some additional capacity in a changing system post LGR and at the time of this pandemic, where, like all authorities, our capacity was depleted because of the virus. So my colleagues might have something more to add, but that's the sort of high level view in answer to your question, Chair.
So thank you very much for that answer.
So it's Julian Radcliffe here, Chair. If I might just add to that, I've worked very closely with 4 of the 5 redeployed colleagues, and it's interesting. I've really valued their support because we've all been working so frenetically in slightly uncircumstances, because there was no, in terms of what we're being asked to respond to, there has been no set formula to follow. Our response has been based on problem solving and innovation day on day in making sure we're doing the right thing by our children and young people across BCP. And what's been really useful is having people slightly external to our system coming in and being part of our system, and being able to support and challenge us on what we're doing. But in the round, actually provide reassurance that actually we are doing the right thing on issues that we're being asked to address. And actually that's been really useful, because it is an extra pair of lungs in the system, if you like, supporting us and understanding what we're doing and the impact we're having. So actually it's I note your point around potential risks attached to it, but it's been really useful as well.
It's Jane White here, just to agree really with Judith and Julian. It's been a helpful support having our colleagues in with us and looking at our development of our practice and an improvement journey.
Thank you very much for that. Just want to share, because there's been a slight conversation on the side panel here that not everybody will be able to see. Councillor Rachel Maidment asked an additional question to hers about what guidance being shared with schools re disproportionate impact of BAME communities. Could we perhaps make this available to parents to reassure them? And Julian has answered that he will arrange for this to be shared. So that's just so everybody sees that. Sandra, I believe you wanted to come in on the end on this one.
Yes, thank you, Chair. I just wanted to say, I'm sure you're going to agree with me on this, that all our staff in children's services have worked extremely hard during the past few months responding to COVID-19. They've done a tremendous job, and I hope you can join me in thanking them for all their hard work. Thank you, Chair.
I can definitely join you in thanking that. Thank the presentation, because there's a lot of information there and a lot of questions, and a lot of hard work is going on. It just leaves me to sum up, and to be honest, it's been quite an interesting discussion with lots of different. There seems to be a theme of mental health coming through. A lot of people have got various comments about mental health. I think getting back to school, we discussed quite a lot in the transition, both for people going back to school and transitioning from one year group to another. We had quite a discussion about reasonable endeavours and the difficulties that is causing some families, and the perception of difficulties that is causing some. We had a discussion about some children who actually were thriving being educated at home. There's discussions about challenges of getting more pupils back into school, multiple inequalities, for example, BAME and others, summer school places, MASH numbers, and external support. So it's quite a varied discussion. Agenda item 8, Children's Services Learning and Improvement Plan, establishing a working group. So one of the functions of ONS is to derive improvements. Not only are there challenges forming from BCP from the 3 preceding councils But those preceding councils did have some requiring improvement on the last inspection, and so the LIP is put into place to address this. Now, Sandra, I believe you want to speak to introduce this one.
Yeah, thank you, Chair. Yeah, well, as you just said, children's services in BCP's 3 predecessor councils all had Ofsted grades of requires improvement, and there was also a category of inadequate for leadership and management from one of the councils. But we are where we are. And so for this council, there is a determination to improve children's services, as well as an obvious need to improve children's services. But these months of lockdown have not helped our improvement progress, and we need to do much more and more quickly. So that's the reason we've asked for this committee to start up again, because scrutiny shouldn't be just about adding value, because used effectively it can and should be used to drive improvement. And at the last meeting, I think that was in March, the committee requested to scrutinise the learning and improvement plan, and that's a great idea. And I think the most effective way to oversee and scrutinise it is through having a dedicated working group. I hope you agree, and we can set one up. So over to you, Chair.
I have a request to speak from Mike White. I don't know, was this one on this mic, or did I miss you at the end of the last one?
No, it's absolutely on this one. I'm with Sandra. I hesitate to say that this proposal is perhaps rather overdue, but I do welcome it and very happy to support it. Thank you.
Right, thank you very much, Mike. What I'll do is I will email out, or you'll get an email inviting people to join the working group. I'm going to email it actually to all councillors, because I feel that there may be some expertise in other places, not just in children's. So as soon as I email it out, please respond. May I ask, has anybody had any concerns of starting the working group? Judith, you have a request to speak.
Chair, I'm really pleased that this proposal has been welcomed, and I'm keen to have a steer from this committee so that I can work effectively with Democratic Services to set this up in the timeline that you would like to see. So how quickly would you like the first meeting to occur? Because that way I can support Democratic Services following this committee. So I'd just like a steer, please.
Well, my personal feeling is as soon as is practically possible. I don't know if anybody disagrees with me on that. It looks not so. Yes, as soon as possible, I would suggest.
Absolutely agree, Chairman. Let's move with this as soon as possible.
Okay, thank you, Chair. Thank you, Committee. And again, to support Democratic Services, which I will do following this committee, a steer on how many members you want to have sitting on this working group.
My suggestion is that we need, I would hope somewhere around 5 would be a good number. I think if we get too much more than 5, it might become too slow to organise things. Definitely more than 3.
I agree, Chairman. I think 5 is 5's about right.
I've had a request to speak from Adea.
Yes. Hello. Can you hear me?
I can hear you loud and clear. Yes.
Okay, that's great. I was just wondering regarding the working group. Will young people be able to get involved in that?
Unfortunately, the working group can only actually be for members on this one. However, I will make sure I engage with young people through the normal forum so that you can have some input and I can feed in for you on that.
That would be great. Thank you. Thank you, Chair.
My pleasure. So, I mean, to summarise, I think we're all...
Chair, could I just come in there, if that's okay?
Please do, Judith.
So in response to the essence of Adea's question, I think I just want to share that the quality assurance and learning framework that is in place but we're re-energising and stepping up post-COVID, does include the need to and the commitment to seek feedback from young people and parent carers who are users of the services so that they can influence the improvement journey, and we will make that transparent to both the working group, and as appropriate the working group will make that transparent to the Overview and Scrutiny Committee. So we are actively seeking feedback from young people who receive early help services and or have social workers allocated to them to support them in their life and their families, and we're very happy to make that visible in the appropriate way to both the working group and to Overview and Scrutiny.
Thank you very much for that, Judith. I have noticed before we move on, I did skip item 5 on the agenda because there were no public statements for the meeting. So in that case, forward plan. Now, the forward plan has not been updated since the work that we did in March. This work will start again as we start to ease out of the lockdown, just so that you know it will be updated and it will be presented more at the next meeting. Next meeting date, 28th of July is the next one on the calendar, and then the 22nd of September. In that case, if we've got no other business, I'll declare the meeting closed. Thank you very much for all your attendance.
Thank you.